Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another episode of the Nikah Masterclass IG Lives that we do on the first Tuesday of every month. Bismillahir Rahmanir Rahim. Alhamdulillah. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala Rasulihi Nabiyil Kareem wa ala alihi wa ashabihi ajma'een. Alhamdulillah, very excited for today's topic, which is birth control and marriage. And Alhamdulillah, we have some very great guests who are going to give us different perspectives on this important topic. We understand that since the advent of the birth control, the modern birth control pill, obviously that has changed society in many, many ways. And so today we have with us, mashallah, Sheikh Joe Bradford, who is our resident scholar at Nikah Masterclass. I'm sure all of you have heard his lectures and his comments that he gives on our channel. We will be also joined by our brother Uthman Mughni, the therapist, family therapist. And alhamdulillah, I'm very excited. First time I'm meeting Sister Dr. Fatima Dawood, who's a OBGYN, and will be giving us, inshallah, really useful insights on this topic. And so the agenda for tonight is pretty straightforward, inshallah. We're going to hear from each one of our guests from their perspective. What does Islam have to say about birth control? How do we talk about this issue with our spouse as we're in the courting process? And also just from the medical perspective, what impact does this have? Are there certain safe ways of doing this? Are there long-term effects and things like that? So alhamdulillah, I have a lot of questions for our guests today and really excited. And if you have any questions, feel free to leave a comment and ask questions, and inshallah we'll do our best to get to those questions. But I'm sure that we'll be hitting many, many different topics. And by the end of this presentation, inshallah, I am sure that we will leave with some beneficial knowledge, inshallah. So with that, I am going to start with our dear beloved Sheikh Joe, as I mentioned, our resident scholar. And so, Sheikh Joe, in terms of framing the discussion, right, obviously we want to start with an Islamic worldview, viewpoint, and make sure that we're framing this topic appropriately. And so I guess the very first question that I have for you is, what is Islam's view on birth control? I guess we'll start with kind of that broad question.
Jazakallah khair. Bismillah walhamdulillah wa salatu wassalamu ala rasulillah. So, the Islamic view on birth control, from very earliest scholarship on the topic until today, is that it is generally permissible as long as it does not harm the body. Allah subhanahu wa ta'ala says, "Nisa'ukum harthun lakum fa'tu harthakum anna shi'tum." Your women are till for you, so take to your till as you wish. He says, "Hunna libasul lakum wa antum libasul lahun." You are garments for them, and they are garments for you. So Islam as a faith is generally a very sex-positive faith. That's a word that not a lot of people really hear, but it is a very sex-positive faith. It does not view sex and sexuality as something which is inherently sinful or which is necessarily wrong, but it is desires are to be fulfilled in the way that is permissible, and in relationships which are permissible. And one of the reasons for forming those relationships is to have progeny, to procreate, and to have children. But many times that is not the only reason. Having enjoyment from your marital relationship, emotionally, intellectually, and yes, even sexually and physically, is something which is encouraged and is permitted. So as long as the spouses are in agreement with the use of birth control, then there's absolutely no problem with using it. It's narrated in Bukhari from Jabir radiallahu anhu, who said, "Kunna na'zil wal Qur'anu yanzil." We used to practice coitus interruptus. We would pull out while the Quran was in the time the Quran was being revealed. And that was a proof by him that this very rudimentary form of birth control, of stopping impregnation, was something which was permissible. And had it been impermissible, they would have been forbidden from it through the revelation of the Quran. Now, There are a number of ahadith, such as the hadith of Abdullah ibn Umar and the hadith of Abdullah ibn Abbas. I'm sorry, the hadith of Umar ibn Khattab radiallahu anhu and the hadith of Abdullah ibn Abbas radiallahu anhu. The former being in Abu Dawud and the latter being in the Musannaf of Abdul Razzaq as well as the Bayhaqi, that the Prophet sallallahu alaihi wasallam forbade a man from doing this without taking his wife's permission, as it is her right not only to have a child, but also it is her right to enjoy herself during the act. Therefore, as long as there is congruence between the spouses, there is no harm that comes from using any form of birth control. Then the baseline is that it is permissible, and everything else it kind of stems from that. So any other forms of medication, of implements, whatever they might be, and Dr. Fatima can tell us much more about that, inshallah ta'ala, then that's permissible for spouses to use.
At what point then does it? Is there any point in which it would become impermissible? Does intent have any bearing on the permissibility?
When would it become impermissible? It would become impermissible if it was permanent, right? And the permanency of the birth control was not for a actual need. So let's say, for example, that a woman would be harmed by having more children. Is it permissible for her to get her tubes tied? Yes, it would be, right? Um, if doing that were to be harmful for her or unable to, and her husband did not want to have more children, or they agreed that they would not have more children, and he had a reversible vasectomy, not a vasectomy which is irreversible, but a reversible one, that will be permissible as well. So completely causing yourself to be able to not have children is not permissible, but anything which delays the ability to procreate would be permissible.
And so
Along,
I know a lot of people talk about the, you know, do not kill your children in the fear of poverty, and sometimes people are using that, you know, that to say that birth control is not appropriate if you're fearing poverty or you don't believe that you're able to support the child. Is there? Can you comment on that?
yeah, ولا تقتلوا أولادكم من إملاق نحن نرزقكم وإياهم. Do not kill your children out of fear of feeding them. We will provide for you and for them. That's to be understood within the framework of all of these other texts where the companions said that this was something that we actually used to do. We would actually perform coitus interruptus, and we were never forbidden from doing so. So it would not enter into the generality of that hadith, or I'm sorry, of that ayah, of it being something that is wholesale impermissible. And I think there's a very important point that sometimes is not taken into consideration. And that is that we are human beings. وَخُلِقَ الْإِنسَانُ ضَعِيفًا. Man was created in a state of weakness. And we will be affected by our overall health. And sexual health is part of that. And so I'm very hesitant to take seriously some of the very, very generalized statements um, that seem to almost obligate the ability to procreate and have children all the time. When certainly the Prophet ﷺ encouraged us to marry and to marry those who are loving and fertile and to have children. فَإِنِّي مُكَاثِرٌ بِكُمُ الْأُمَمَ يَوْمَ الْقِيَامَةِ, because I will boast of your numbers on the day of judgment. But he, sallallahu alaihi wasallam, is also the one who knew of these practices amongst his companions and did not forbid them. All right, so we don't have anything from the Quran or from the Sunnah of the Prophet sallallahu alaihi wasallam. In fact, he simply said that there needs to be an agreement between the spouses before doing so. So this shows us that the idea of health, and specifically sexual health, is not simply just about denying our body's rights over us and procreating, endlessly and at will, but there is some idea of there being a rhyme and a reason or a plan behind us having children. Otherwise, why would he sallallahu alaihi wasallam tell a man that he must, take his wife's permission before doing so?
Jazakallah khair. And I think you may have answered this maybe indirectly, but are there any circumstances where birth control may be encouraged or discouraged?
Absolutely. When there is a quantifiable or a highly probable effect on the health of the woman specifically, or on the health of her child, right? Let's say, for example, that she's still breastfeeding or she's still caring for small children, and getting pregnant and having children would significantly affect her ability to care for them, and thus her health, and thus the health of the children. Then planning and scheduling out, one's needs would not be problematic at all.
And I guess one last question before I move on. We could talk about the Islamic side for hours, but um, is there any difference of opinion? Are there any modern, you know, um, discussions happening between the ulama in terms of permissibility? Are there any new discussions coming forth as it relates to birth control?
I mean, not that I know of. I mean, the it mainly has to do with the use of medicine and the relative, harms or benefits of those medicines. Things like whether or not a person would use hormonal pills or use intrauterine device, an IUD. Which of them would be more beneficial, less harmful, um, uh, have the same effect? Those, I think, are all relative to actually the situation that the two people find themselves in, as well as the advice of their doctors. So it's very important for us to defer to expertise in these areas, and not be very dogmatic about it, because we can end up harming ourselves, harming others, um, by that type of dogmatism. Now, there are considerable debates about things like, IVF
Mm,
and surrogate pregnancies and all of that stuff. But generally, with birth control, it's very straightforward, right? About it being generally permissible. Can be an obligation when there is harm that would result from not taking a form of birth control, and that there be an agreement between the spouses about that.
Jazakallah khair. Dr. Fatima, again, Jazakallah khair for joining us. First time meeting you. So, again, my salams to you and appreciate you taking out time on a weeknight to, help educate me specifically. When we were talking about this topic, I'm like, man, subhanAllah, what do I know about this topic? And so I'm very excited to have you to, kind of educate me and, other brothers and I'm sure sisters as well, as to birth control. And maybe we can start with the different birth control methods that are commonly used.
Wa alaikum assalam. Thank you so much for inviting me onto your platform. I'm already learning so much, and I hope to be able to contribute something of value to the people who are watching. But when it comes to birth control, I mean, again, this is one of those things that you can talk about for hours. But in general, you can divide birth control into what's reversible versus what's not reversible, aka permanent. When we're talking about permanent birth control, primarily it's sterilization, right? So the colloquial term for it is getting the tubes tied, but really in modern times, we're actually removing the full fallopian tube. As opposed to just removing a segment of it or burning it, like they used to do back in the day, primarily because we're finding health benefit from doing that. We're finding a decreased risk of ovarian cancer in the future. And so, in these situations, while there are some circumstances of tube tying being able to be reversed, nowadays, now that we're fully removing the fallopian tube, it's 100% irreversible. And so, really, it's only appropriate for couples who are absolutely certain that they don't want children in the future, or if there is again, like a health risk that would make it so that it is so incredibly important, like, with 99.99, what have you, percent certainty that you would be able to prevent pregnancy. And then in terms of the reversible forms of birth control, where that's stuff that we've kind of already mentioned, kind of going from the most effective, so the least likely to lead to contraceptive failure and then unintended pregnancy. We have the long-acting reversible contraceptives. It's kind of a family of birth control methods. So this includes the IUD, which is there's a hormonal and a non-hormonal version of it. Non-hormonal is good for up to 12 years, but you're not committed for the full 12 years. It'll be removed after a month. Even if you wanted to. And then the hormonal version, which can last for up to 7 years, same thing, you're not committed for the full 7. Those are about 99.8% effective at preventing unplanned pregnancy. They also have other benefits as well. They can make issues with like pelvic pain, distressing menstruation. There are some women who have very, very difficult menses, and so certain IUDs would help. So there are non-contraceptive benefits to various forms of contraception, and I think we're going to probably talk about that later. And then there's also the implant. In the United States, the brand name of it is the Nexplanon. That's really the only one that's available on the market. That one is just as effective as removal of fallopian tubes, so 99.9% effective at preventing pregnancy. That one's good for 3 years. And so those are the most effective, but it's not necessarily effectiveness that everyone prioritizes when it comes to choosing a form of contraception. So then kind of a step below that in terms of effectiveness, these are, depending on how good you are about taking it, somewhere around 93 to 95% effective. These are your patch, your pill, your ring. The depot shot is in this class as well. All of these methods, they're all hormonal. They're all reversible. And they're not devices that you need in your body. So for someone who, maybe that's not acceptable to them, or they have anxiety about something like that, something like a pill is not very invasive. To like place a patch on your skin, for example, get an injection once every 3 months. So those are, I would say, like less committal, slightly less effective, but still overall very good forms of birth control. And then kind of a step below that in terms of effectiveness, and these numbers kind of vary, but this includes barrier contraception, so male and female condoms. This includes Phexxi, which is relatively new on the market, so it's a gel that's placed immediately before intercourse. There's the diaphragms and caps and spermicides and things like that in this class. These are roughly 75 to 85% effective, depending on which one that we're talking about. But those are all non-hormonal. And so for someone who is prioritizing non-hormonal birth control, wants to avoid a device, those may be appropriate options for them.
So what do you see in your practice in terms of what's the most common type?
I would say across the board, probably the most commonly utilized type that I'm seeing is the pill. But statistically, the most commonly used form of birth control is sterilization. Again, this is kind of like for the general population, not specifically talking about a Muslim population, because if you go year by year, more and more people are becoming, they get surgically sterilized, whether through vasectomy or through removal of the tubes. But if we're excluding that for a moment, I would say probably the pill. It's the least intimidating because most people have taken a pill in some form of their life. So it's probably the most common.
So you kind of alluded to the difference between the general public and the Muslim community. Can you dive into that a little bit more? Do you see different uses in different cases?
Well, primarily when we're talking about like birth control and marriage, and this is assuming that like someone's not a widow, they're not a divorcee. Like, let's say someone has never been sexually active before, they're getting married for the first time, and they're considering forms of birth control. Again, like we're talking specifically about the Muslim population, I would say IUDs are probably the least utilized of the various methods, just because it is an invasive procedure to have done. And if a woman's never been sexually active before, having the examination in general can be an uncomfortable experience. And then adding on top of that, placing a device can also be an uncomfortable experience. So I would say IUDs, while I'm a fan, I think they're great, not only in terms of their contraceptive benefits, but also their non-contraceptive benefits. I would say those are probably the least utilized purely because of like pain concerns. Whereas I'm seeing a lot of utilization of the pill as well as the implant, the Nexplanon, for my patients who are Muslim in pre-marriage.
And you had mentioned kind of within the reversible section, hormonal versus non-hormonal. Something that I think about a lot is the hormonal impact. Can you talk to us about the hormonal impact? Is that a negative thing? Is that a neutral thing? How should we kind of think about that?
I think hormones get a really bad rep. I feel like when people talk about exogenous meaning from outside the body, administration of hormones, people just think, it's not natural, there's side effects. And it's true, there are side effects to all forms of birth control, whether hormonal or non-hormonal. But it's also important to consider the risk of the alternative, right? So if someone is not willing to use, let's say, hormonal birth control because they're concerned about risks, and understandably so, well, then we also have to keep in mind that the average couple that's like under 35, their chances of conceiving in 1 year, if they're not using any form of pregnancy prevention, is 80%. And so we have to think about the risks of pregnancy. And pretty much across the board, pregnancy pretty much 100% of the time is more dangerous than any form of birth control. When we're talking about risks of stroke, risk of heart attack, risk of death, risk of, blindness, like, this like crazy, like rare stuff that you would, that are, yeah, sure, there are absolutely risks of birth control, but pregnancy is much more likely to cause harm to someone, again, across the board when you compare it to any form of birth control, hormonal or non-hormonal. So it's important to remember that while forms of birth control have risks, that pregnancy has very real risks as well, and pregnancy is always more dangerous.
So Dr. Fatima, if I could interject, I just want to be clear about this, because I think that the average person probably says, well, pregnancy is natural. The body was made for pregnancy, and especially men. I think we discount what a woman's body goes through during pregnancy. If I'm understanding you correctly, quantifiably, the risks related to actual pregnancy and the harm that it could have on the body if there is a medical condition is greater, and I guess I'm understanding that it is much greater than any of the perceived harms or possible harms from hormonal or non-hormonal birth control. Am I understanding that correctly?
You are. So quantifiably, if we're looking at the data that's out there, a woman's risk of what we call morbidity or mortality, so the chances of dying or having significant bodily harm, is much higher with any form of pregnancy, whether it's early pregnancy, late pregnancy, delivery, postpartum, etc., compared to any form of birth control. If you think about it, so like the levels of extra hormones in someone's body from birth control, let's say, is this much. From pregnancy, it's through the roof, right? The amount of extra hormone exposure during pregnancy increases. And this is even if someone's perfectly healthy, they're young, they're healthy, they have no pre-existing medical conditions. Pregnancy is dangerous. Birth is dangerous. Some people deliver surgically. Some people have a C-section. That's major abdominal surgery. And then postpartum as well. At each of these steps, a woman can suffer significant morbidity or mortality that is way beyond birth control. This is not me minimizing the risks of birth control, but it is important, I think, to put things into perspective.
Do the hormone related pills, do they have a long-term effect? So after you stop taking them, is there a lower chance of fertility or any long-term effects like that?
So I think that that's something that I hear a lot, especially in our communities, although this is not something that's exclusive to the Muslim community, is concerns about subfertility or decreased fertility due to various forms of birth control. With the exception of the Depo shot, and I'll talk about that in 1 second, fertility returns pretty rapidly. post discontinuation of any form of birth control. So whether you have an IUD removed or you decide to stop using the pill, fertility returns, pretty much within the next like 4 to 6 weeks. The reason that the Depo shot, so the Depo shot is an injection that you get once every 3 months, approximately 95% effective, depending on how good someone is about making sure that they come in for the injection. We have seen delayed return of ovulation. So ovulation is a woman releasing the monthly egg that can potentially meet a sperm to become a baby. We've seen delays for up to 18 months. This does not mean that this person's fertility has been permanently altered. It just means that there's a chance that you may not be releasing an egg for 18 months post discontinuation of the injection. And so while, again, I'm a fan of the Depo shot, I think it does have a lot of benefits for the right population. If there's a couple who is looking to, in terms of their family planning, get off birth control and try to conceive right away, the Depo shot is not a good option for them.
What's the average time from that shot ending to when they may be able to conceive?
So I don't know the exact average, like when you look at everyone, but in terms of the upper limit of normal, we've seen ovulation not return for up to 1.5 years. And obviously, if you don't ovulate, you can't have a baby.
I wanted to, and I don't know, Naveed, if you had these in your questions or not, but I think one of the important things for us to do in these types of sessions is also to kind of challenge some of the ideas that we find in the internet ether, or even kind of in the community. And I'm not really sure where this idea has come from, but I have heard it from a number of people, and that is that birth control and hormonal birth control changes a woman's psyche to the point that attraction and likes and dislikes before and after become rapidly different. And I think there's a little bit of kind of villainization of women in that narrative. But I'm wondering what are the realities of these types of these ideas, that she's desirous of her husband with certain traits before and then not after, and that type of thing.
So, there is, even with all kinds of stereotypes, there is always a sliver of truth in those things. But again, it's important to not be reductionist about women either, right? So it is true that for some people, not everyone, but for some people, using certain forms of hormonal birth control that are systemic, so that kind of go through the whole bloodstream, pass through the liver, etc., that they can cause things like mood swings. They can cause decreased libido in some situations, not for everyone. But that is a reality that I sometimes have patients come to me reporting. And so my job as their doctor is to believe them and to kind of work with them and figure out, well, what would be a good alternative, right? However, I think that it's important to not reduce women to their hormones, right? Men have hormones just as women do. Just because men do not, menstruate on a cyclical basis does not mean that a man's hormones does not have any kind of effect on their mood. And in fact, when we see that men take exogenous hormones like anabolic steroids, for example, in the gym scene, that makes them really angry, right? So hormones play a role in all of our moods. However, a woman's mood, a woman's what we call the sexual response cycle in women, it's multifactorial in terms of its influences. It's not purely based on hormones. It's not purely based on your relationship with your significant other. It's not purely based on your own personal confidence and body image, but rather it's an amalgam of multiple things. But the short answer is birth control can affect it, but I think it's a little bit over exaggerated in the popular media.
I don't apply, by the way. Sorry, didn't introduce myself. Just out of curiosity, would the same line of thinking apply that, if there is a sliver of truth to that, doesn't pregnancy cause more of that?
You could say that as well, right? Mm-hmm. So, and again, pregnancy doesn't happen in a vacuum. So pregnancy, the emotional changes, the physiologic changes, the physical changes that accompany pregnancy, lack of sleep, just general discomfort of being pregnant, anxiety about birth, and then the marathon that is birth, the pain associated with birth, the permanent damage that a woman can cause her body through giving birth. All of that can also affect, again, the general psyche of a woman and whether or not, and, like how she feels about like being intimate with her partner at that particular chapter in her life.
With the birth control, are you introducing a hormone or are you blocking a hormone? Or like blocking something, or are you introducing, if that makes sense?
It depends on the kind of birth control. So, for example, if we're talking about the non hormonal IUD, this is the copper IUD, this does not affect your hormones whatsoever, right? Whatever a woman's ovaries are doing naturally, that doesn't change. But rather, what the copper IUD adds is inflammation within the lining of the uterus that's toxic to sperm. And so that's how it prevents pregnancy, right? Whereas the birth control pill, you are introducing hormone in order to block the monthly fluctuation of hormones that comes from ovulation, right? So different forms of birth control have different mechanisms of action. And because the mechanisms of action are different, then the potential side effects are also different.
Do you see women ever coming to your office to use birth control to kind of control their periods? Like, so for example, they know their menstrual cycle is pretty regular. They're about to go for Hajj, for example.
Yes, and it's incredibly common. And again, if we're talking about the Muslim population, there's a lot of anxiety and fear and stigma about being, let's say, unmarried and on birth control and wondering what their family may say or what their friends may say if they were to find, for example, a pack of birth control pills in their bag or something like that. But again, contraception, with the exception of the non-hormonal IUD, which the only use of the non-hormonal IUD is contraception. There's no other benefits to it. But all other forms of birth control typically have very favorable effects on the menstrual cycle. So people who have debilitatingly heavy, painful periods, I'm talking about people with endometriosis, fibroids, these gynecologic medical conditions that affects their quality of life, that affects their health and well-being, birth control can help fix that. Birth control is a treatment and a preventive measure to prevent uterine cancer. So for example, patients with PCOS, patients with certain medical conditions that are at high risk of uterine cancer or high risk of ovarian cancer, birth control can help decrease the risks of those things. And so I very commonly prescribe birth control for non-contraceptive benefits, but they also get the contraception on the side.
You had mentioned that it takes, maybe 4 to 6 weeks to go back to normal fertility, but does taking birth control pills for a long time, does that increase the return rate to fertility?
No, it doesn't. So from what we're seeing in terms of like case control, right? So the very common scenario that I hear is, well, my aunt had a baby when she was 20. She got pregnant right away. She was on birth control for 15 years and then she came off of it to have another baby and she struggled to have a baby and they went years and they weren't able to conceive. And so one has to think, okay, well, is correlation causation? Was it the pill that decreased her fertility? Or was it the fact that she's older now? And we know that a woman's age has a significant effect on her fecundity being defined as your ability to get pregnant, stay pregnant, take a baby home. And not to mention that fertility, there's also male factor that comes into play. And there are non-hormonal influences that affect a woman's fertility. So while birth control can play a role, in general, what we're seeing in terms of the data is that, again, with the exception of the Depo shot that can delay your return to ovulation for 18 months, birth control use, whether it's for 3 months or 3 years or 10 years, in and of itself does not diminish fertility.
And I'm just going to kind of throw this to Sheikh Joe. So as Dr. Fatima kind of outlined the reversible, irreversible, I think Sheikh, you had said that irreversible would not necessarily be permissible unless medically required. But on the reversible side, is there any distinction between the 3 different classes that Dr. Fatima had outlined in terms of permissibility of use?
So we said that's reversible, irreversible, and what was the third?
So there's within reversible, Dr. Fatima had outlined 3 different levels, one being like, the procedural, the next being the pill, and the last kind of being in the condom class. So is there any distinction between permissibility of those 3 different classes of reversible birth control?
So there, I mean, all of this predicates itself not only on the relative harm of any given pill, procedure, or implement, for lack of a better term, right?
Sure. Yeah.
Prophylactic or something. But also the need, right? So if the doctrine of need under Islamic law, there's these three levels of kind of needs-based rulings. There's darurat, those things which are absolute necessities and that are that pose a danger to life and limb. There's hajat, those things that do not pose an immediate danger to life and limb, but if left unchecked, produce a level of hardship which the Sharia does not concur with, or does not allow, or does not want, right? Let's take a far off example for that, right? Is it really difficult in Hajj if someone were to absolutely have to go and throw their stones at the Jamarat, every day, after the Zawal, so from Dhuhr all the way till Maghrib, let's just put it at Asr time, right? No, it's not. It's not impossible. But for some people, right, women traveling in groups, emergency workers, shepherds, and all kind of, these types of people, there is a dispensation for them to actually even go during the evening when it is cool and when it is easier, and it is relatively more facilitated. So that's certainly not facilitating, or that's certainly not addressing a necessity, right? And it's certainly not just a nicety, with the third. So dururat, hajat, and tahsinat or tahsiniyat. So we have, necessities, needs, and then accessories, for the lack of a better term. Those things that are nice to have, but don't touch life and limb, and certainly are not ongoing forms of difficulty or harm. So you can see how the need debate here, or the doctrine of need, is very gray, right? So it's a gradient. And I think what's very important for people to remember about Islamic legal rulings is that they are not these Aristotelian truth values of yes or no, black or white. This is one of the problems with the kind of Hellenization and the overemphasis on logic and syllogisms sometimes in our curriculum. While very helpful for learning to create a correct analogy, they can sometimes bring about very black and white thinking. And so these rulings are never black and white. They're gradients. So this is why we have things like haram, makruh, mubah, mustahab, wajib. Everything other than haram is actually one segment, which is can and absolutely can't. So going back to your question, whether or not a couple wants to use birth control, and they say, well, just use condoms. It's the cheapest, most facilitative way. It's actually quite it can actually be kind of like difficult to facilitate all the time, right? Yes, there can be allergies towards the materials that are used, right? But it's also, if for a very sexually active couple, it's not going to be the thing that's going to allow them to enjoy themselves sexually, as well as protect them when they need it. And so they would not be considered to have done anything wrong, right? Because I know that that's a common thought process of people. Like, am I doing something wrong if I use hormonal or non-hormonal birth control? And the answer is no. If it's not harmful to you, right, and it's not irreversible, and there's a need, wherever that need kind of is on that level of gray, right? Then it is then it's permissible for you to do. And I guess the moral conundrums that people have, or the moral culpability that they have, is something that Islam is generally silent on, because it varies so much from couple to couple, person to person, and state of health to state of health. So, me in my 20s is not going to be me in my 30s, me in my 40s, 50s, or 60s. My health in those ages are not going to be the same, right? A woman who is, pregnant and still sexually active is not going to be the same as the one before. A man who is, as Dr. Fatima had mentioned, maybe taking certain types of, testosterone shots or something, he's not going to be the same person, right? So you have to look at every case, and I think the variance of those cases is why some of these rulings are left open-ended, and they're left up to the better judgment of the people. And so what we really need is people to, know themselves and know their lords. Not lords in the plural, but they're their Lord, right? Know themselves and know their Lord. When the more that they know about their health, and the less they have of kind of very sophomoric ideas about sex and sexuality, and the purported bad things that they feel about that sometimes, unfortunately, the more empowered they can be to make informed decisions that avoid harm, address a need, and still allow them to have children later on.
And I'll turn to Osman. Have you seen this in your premarital counseling, or just in marriage counseling at all, this discussion of birth control? I feel like, as do the brothers get involved in this conversation? Is this kind of something that the women are kind of taking care of? Like, how have you seen this conversation happen between couples?
Yeah, no, I think the conversation doesn't happen enough. I think there are certain assumptions that are made where people jump into it, not actually having a clear understanding of when they want to have kids, when they want to try, do they want a gap where they are using contraception? I think that there's a lot of sexual education in general that needs to happen in our communities. Dr. Fatima, I'm sure you see that quite a bit, just, through lack of awareness. And then on top of that, like I also see sometimes people flip-flopping, unfortunately. Like I've worked with couples where, let's say the girl is like, no, I don't want to have kids. And so then the guy's like, no, this is an absolute deal breaker. I want to have kids. And so, okay, great. Part ways then, right? There's no obligation to get married. Then she'll kind of be like, okay, well, maybe I do. And so the guy will stick around. And I've actually worked with a couple where this dragged on for a year and a half, right? So, we don't emphasize these conversations enough, right? That's one thing. I also want to speak on the other spectrum. I was thinking about this, subhanAllah, and I'd love your guys' thoughts on it, right? Because of course our deen promotes, having children and propagating the human race, and so the Prophet ﷺ can boast about our large numbers on the Day of Judgment. I wonder what your guys' thoughts are about, like, do you feel that culturally sometimes this takes an extreme to the point where there are women who know themselves and know that, like, I know myself, I know my personality, or even guys, and I cannot be a parent, but I don't want to face the community, and I'm like 5 years into the marriage, and they're like, oh, so when are the kids coming? And then out of almost like this pressure obligation, they bring kids into this world fully knowing that they're not prepared for it, or fully knowing that they didn't want kids. And I have seen this. I have seen, people get pregnant and, just say, honestly, like, I never wanted to be a mom. I never wanted to be a dad, but it's just, I wanted people to get off my back, So I do think, each case is unique, but I do see this, on both extremes. And then I end up working with the children who are products of this. And it's very unfortunate.
You definitely see in our community the cultural impact of, after 2 years or 1 year, where's the baby?
Right.
Second baby, where's the third baby? And I think that's definitely a cultural phenomenon. And
the girls get it worse though, right? I think like
Oh,
I don't know,
100%.
yeah, like as bros we don't get questioned as much, but the sisters get it a lot. I don't know, Sister Fatima, if you have had young women complaining about that ever. Yeah.
I feel like even if women go into a marriage excited to have kids, right? They want to have like a soccer team with their husband, right?
Mhm.
And they'll go through pregnancy, and pregnancy is so difficult for them, either from a physical aspect or a health aspect. And then the newborn phase, which is one of the most like mentally and physically taxing chapters of anyone's life. Sometimes people say, well, then that's it. You know, I don't think that it is best for my physical health, for my mental health, to continue to have more children, right?
Mhm.
So there's
Mhm.
that. And then we also can't forget that reproductive coercion is a thing, right? It's not something that is not experienced within the Muslim community, where one party, you know, let's say, you know, the classic example is like poking holes in a condom or saying you took your pill that day but you didn't, and so not agreeing on whether or not you as a couple are going to be using contraception, so then the other person finds themselves in a position that they didn't want to be, and sometimes that is used as a tool to control, and this is primarily the woman because she's the one who's carrying the pregnancy, right? She's the one who's gestating, and so sometimes that disagreement can turn into an extreme of people carrying pregnancies that they really did not want to carry either at all or at least for that particular moment in time.
Yeah, I've had couples that were on the verge of divorce and one partner did not want it, and they come back to my office and they're pregnant. So yeah, that happens. Yeah.
And I think
Yeah,
this question,
the idea that marrying will solve the problems of the person is a big issue, and then also, well, if they just have kids, that'll solve the
Exactly.
problem.
That I see a ton of that.
And
I see it. Yeah.
Osman, where do you see, you know, like these are symptoms, right? So what are the root causes that are bringing people to kind of, you know, we can talk about culture and all of that in the end of the day, right?
Right.
I know that in some cultures, cultural pressure is much greater than others.
Right.
But in the end of the day, the people are adults. They are making choices. What is it that's kind of motivating them psychologically to subject themselves to something that they know or feel is going to be harmful for them?
Right. No, I mean, like Dr. Fatima was saying, I mean, there is a certain level of like, you know, within partners, like coercion and pressure and so on. There is like that fear of like, okay, like you said, like maybe a child will fix things. And then also, you know, the opposite side, like if, you know, a couple is set on having kids, but then experience kind of teaches them like, God, we're fighting a lot, you know? Or if the woman feels, understandably so, this is kind of a PSA to the bros, that, you know, I can't rely on my husband. So how can I rely on him to take care of me when I'm in a really vulnerable spot, right? Just a side note, Dr. Fatima, if you could talk a little bit about oxytocin and how important it is for the husbands to, you know, physically be there during delivery. To any one of my friends who their wives are pregnant, they're about to give birth, I tell them, dude, hold her hand, hug her, be there for her, because you know, if you want to talk about, you know, multifactorial, like just even creating that environment, it has an impact. And please correct me if I'm wrong, it has a huge impact on the delivery, the whole process, you know, everything. And I've seen situations where women are left scarred by this, where, you know, initially they're like, yes, I want to have multiple kids, but then they're like, I'm not going to go through that again. And they will remember specifics about that day, you know, what happened, what didn't happen, why the guy let his entire family into, you know, the room, you know, when his wife is, you know, in a pretty vulnerable position, right?
So it's interesting that you mentioned that. I'm assuming that you're talking about oxytocin, like the oxytocin that we make within ourselves and not the medication. Just making sure.
No, you're good.
So it's interesting. So when you look at animal models, like other mammals that are giving birth, we know that birth will slow down when an animal feels that they are unsafe or that they're afraid. And the whole, like, if you know, from the scientific perspective, the whole idea is that, you know, birth, like labor will slow down so that the animal is able to escape and go somewhere safe, right? There's no human studies on this, at least that I'm aware of, but it's not too far of a mental jump to then say, well, if a woman does not feel safe and cared for and comfortable in the environment that she's giving birth in, that there can be pathophysiology associated with the labor process, increased risk of labor abnormalities and labor dystocias. I've seen it all. Like, I've seen, you know, the very attentive partner who's like getting her water and holding her hand and, you know, speaking kind words to her and encouraging her. And it's beautiful to see. It never, ever gets old. It's so beautiful. And then kind of on the other side of the spectrum, you have a guy who brings his PS5 into the room and is kind of doing his own thing. And it's happened many, many times, right? And so, you know, when we're talking about birth trauma, right? And even though, you know, a couple or a woman can go into her family propagation years and say, yeah, you know, I really want children. I love children. I've always wanted to be a mother. I'm excited to have multiple children. But through a difficult traumatic birth experience, be it due to a medical cause or just due to the environment that she was in, the support or lack thereof that she was receiving, that can have lasting effects on a person's desire to ever want to do that again. And not just that, but it can also increase the risk of postpartum depression. It decreases breastfeeding rates, which we know benefits both the mom and the baby. So it has lasting effects, not only in the short term, but also the long term.
No, inshallah, as we kind of wrap up the session, we have a few questions, but I just wanted to see if Sheikh Joe, Usman, Dr. Fatima, if there's any cross questions or anything that we want to address before we turn to Q&A, inshallah.
I don't have any questions. I think the one thing that I think I would just encourage everybody to do is, you know, as Allah subhanahu wa ta'ala says, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. Ask the people of expertise if you do not know. Ask the people of remembrance, those that have knowledge, if you do not know. And this is broad. This is not just ask scholars. And this is a big problem that we have in our community sometimes, right? We're not saying deny scholarship, and we're not saying do not take religious instruction from scholars. But there are limits. The scholar's job is actually, my job is not to come and say, Dr. Fatima, your medicine is correct, right? Because that's an empirical issue. I can simply say, if Islam negates harm, if there is harm from that medicine, then we need to look at other considerations, like, you know, relative harm versus necessity, right? This is allowed, this is not allowed, but it is not for me to, you know, to place a restriction on that which is permissible, right? Or to declare impermissible something that is permissible. It's simply to say, if the facts that are presented are true, then this is the situation, right? This falls into the permissible versus permissible bucket, or, you know, it's on this scale. And the reason why I'm saying this is because I see a lot of people who will use a religious sentiment to kind of override what can be a medically necessary opinion in their life. And at times they can also have a bit of denial about what is medically necessary. So my advice to everyone is, yes, you know, speak to your religious advisor and those people that you trust, but also find a medical professional that understands your values, understands your anxieties around your values, right? Understands some of your cultural proclivities, and can advise you within that framework, right? Within the framework of expertise, and knowing what your own religious values are. Not that they're going to give you a religious ruling, but they're going to be more equipped to help you navigate that space so that you're not harming yourself medically because of a perceived religious anxiety, which is unnecessary. And then secondly is to trust those people of expertise. And if you don't, you should not trust unrestrictedly. You can always get a second opinion, right? But sometimes there are issues that are so clear that even a second opinion can sometimes just be a waste of your time, right? So developing a relationship with your medical caregiver, I think, is very important as well, as these issues necessitate a lot of trust in order to be able to speak to them about someone, or speak to someone about them. And so it's important to take that in mind. We take into consideration the expertise of people in their worldly domains, and the Sharia does not deny that. The Prophet ﷺ was asked about pollinating trees by hand, and he said, well, if you left it, wouldn't it work? He asked a rhetorical question, and they thought he was saying, if you left it, it would work. He was dictating to them a worldly outcome. And then when he passed by their date palms later on, and he said, "Ma balu nakhilikum? What happened to your date palms?" And they said, "Well, you said," and he sallallahu alaihi wasallam said, "Antum a'lamu bi shu'uni dunyakum." You all have more knowledge of your worldly affairs. Hadith is in Sahih Muslim. So this shows that there is a room for expertise that is not that is taken into consideration. I believe it was Rabi ibn Amir when they came to the Battle of Badr, and the Prophet ﷺ wanted to encamp in front of the water, or I'm sorry, behind the water. And he said, "O Messenger of Allah, is this a decision that you made because of revelation from Allah, or is this a decision that you've made out of war and stratagem?" He said, "No, this is war and stratagem." He said, "In that case, this is not war and stratagem. Go and cut your enemies off from the water, camp in front of the water instead of behind it." And the Prophet ﷺ took his opinion, right? So it's very important for us to value expertise. And I want to, thank all three of you, but all three of you are experts in your field for the work that you're doing. And especially Dr. Fatima for joining us today for the first time. Jazakallah khair.
Dr. Fatima, any final bits of advice or anything that we should consider as we kind of wrap up the discussion on birth control?
I think just briefly, thing that I didn't have a chance to kind of slip in was that if this is advice for women or for couples planning marriage, to not, if you're using some form of medication for birth control, IUD, the pill, like the injection, whatever, don't start it right before marriage or right at the time of marriage, because you don't know how you're going to react to it. You don't know what kind of side effects you're going to get. And it is very, very common to have irregular spotting kind of on and off as you initiate a form of birth control, which can affect the ability of someone to travel or pray, be intimate. And so I would say, again, from just a medical perspective, consider starting at minimum 3 months before your planned marriage, so that if it works out, great, you know how you feel on it. But if it doesn't work out, you have time to kind of go back to your doctor and go back to the drawing board, so that you're not in the middle of your wedding or your honeymoon or something like that and having a medical issue.
I never thought of that. Alhamdulillah. And Usman, any tips on how to have the discussion and when to have the discussion?
No, barakallah feek. Yeah, no, I think that just listening to everything Dr. Fatima and everybody has said, barakallah feekum, it's enough to say that we should have the discussion. I don't think the discussion is being had, period, right? Even in premarital counseling and in the whole courtship process, the specific questions. So I think that this should encourage people going through this process to start asking these questions. Even something like you just mentioned, if we are going to use contraceptives, that if we are going to use birth control, when are we going to start it, and so on. I think these are questions that can be asked pretty early on. Yeah.
Jazakallah khair. And Sheikh Joe, we didn't have much time for Q&A, but there was one question that did stick out to me that, I'd like to ask is, does a woman need her husband's permission for birth control?
Does she need her husband's permission for birth control? I would say in general, yes, as the expectation is that when you marry, there will be procreation, right? The expectation is you should have had that conversation. To take birth control and hide that from your spouse, right? It is problematic morally, ethically. In addition to even being, perilous to your health and then them not knowing, or even his health. So I think that, framing it as permission is difficult for me to compute. And the reason being is that I think this has to be one of those conversations that people have in goodwill and care and love for each other before we get to the, did you have my permission? You didn't have permission. And everything becomes very transactional. Right. And that's, I think, one of the problems that we have is a kind of transactionalization of marital relationships. We've talked about this in the Nikah Masterclass sessions, that when there are disputes, marriage, I don't want to say devolves, but marriage reverts to a transactional analysis in order to allocate rights and resolve disputes. But marriage from its outset, mabniyun ala al-musamaha wal-mukarama. It is based upon clemency and generosity and kindness. And so even just beginning the conversation of, do I have your permission or not, I think is a problem with approaching a very important topic like this. And it needs to be framed in, what are the benefits, what are the harms to both of us, and how are we planning our lives together? Allah knows best.
I mean, if somebody does that in that situation, if they're either hiding it or too scared to speak about it, that speaks to a deeper problem, right?
Yes. Yes.
Yeah.
Yes. Absolutely. Now I do want to state one thing, and that is, if there were a medical situation where if a woman did not take birth control, she would be quantifiably harming herself, right? So let's say she has a condition, but her husband is of the type that, I don't want to hear about that. I don't want to talk about that. There's a brick wall, so there's kind of, what do they call that? Stonewalling on the part of the husband. And her health, her overall health, necessitates that she takes that, and she can't tell him, then she's not sinful in that situation. And how do we know that? Because Hind bint Utbah, radiyallahu anha, came to the Prophet ﷺ. Her husband, Abu Sufyan, while being wealthy, was very stingy. And he did not spend on her and her children. And so the Prophet ﷺ said, "Khudi min malihi ma yakfiki wa waladiki bil ma'ruf." Take from his wealth what's enough for you and your children within reason or within custom, right? So while a woman here would not go and become, say, get sterilized, right? Then, of course, unless there was some medical necessity, but if she were to use birth control in the instance where her husband is not being generous and amicable and clement and having these conversations, because there are some men that don't understand women's physiology and don't want to try and understand it. And this is a problem with men in the community, right? And I think it's one opportunity that I always take when teaching young men, specifically teenagers, ahkam al-hayd. It sounds contradictory, but the chapter on menstruation is in the book of purification for both men and women. Why is that? It's because if men don't know this part of the chapter, then they're going to be judgmental and harmful to the women that are in their lives, right? So in the case, and we don't want to make this the norm, right? But in the case where a woman, her health would be affected, and she's unable to have that conversation with her husband, or he's obstinate and unwilling to have that conversation, she would not be sinful if she did for the protection of her own health. Allah knows best.
Jazakallah khair. And Jazakumullahu khairan to all of our guests today, Sheikh Joe, Usman Mughni, and Dr. Fatima. Again, Dr. Fatima, thank you so much for taking out the time to join us. As you all know, inshallah, we will come back the first Tuesday of November, inshallah, with a new topic on marriage. Please follow us on Instagram. Visit our website, nikahmasterclass.com, for a full 8-hour course and many other resources that we are trying to create to help the Muslim community understand nikah, understand marriage, and so that we can, inshallah, follow the sunnah of our beloved sallallahu alaihi wasallam. And with that, again, jazakumullahu khairan. Keep us in your du'as. We'll do the same. And may Allah bless all of you. Jazakallah khair. See you soon,
Thank you.
inshallah.
Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh.